Hi, everyone. Thanks so much for joining. Welcome to this information session offered by the Department of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. My name is Sally Safi, and I'm the Director of Graduate Studies in the department. We're really excited that you all have joined us today to learn about our department, the programs we offer, and how our students are engaged in work with our faculty. So we have some really special guests today who you'll have a chance to learn from. So I'm going to give a very brief introduction to our department, and then we'll spend the bulk of our time today hearing from our current students and faculty about their research. They'll discuss projects on which they collaborate, which should give you a sense of opportunities beyond the classroom here at the school that are available to our students. After we hear from our student faculty pairs, the education team will stay on to share some information about our degree programs, answer your questions, but please feel free to ask questions in the chat at any point during the session, and we'll respond to questions as they come up. So the Department of Population, Family, and Reproductive Health is one of 10 departments at the School of Public Health here at Johns Hopkins. The department has a really long and rich history. Decades ago, the Department of Population Dynamics merged with the Department of Maternal and Child Health, and we became the Department of Population, Family, and Reproductive Health. So the work of the department is diverse, but we are all united in our focus on promoting health and well-being across the life course. We use a multi-level life course framework, which you would learn about as a student here, to understand public health issues and the interplay of biological, behavioral, societal, and other factors across a person's life and across generations. And this framework helps us to advance health equity through effective public health research and practice. Students in the department select an area of interest within PFRH to sort of drill down on a specific focus area, and those areas are shown here on the slide. But in practice, there's a lot of overlap in these areas. Courses we offer fall into multiple categories, and faculty work does not often fit neatly into just one of these boxes. So rather than constrain students, these areas are meant to help guide students' selection of coursework and refine interests as you are here studying public health. So today we're going to focus on projects that align most closely with child and adolescent health, though I suspect we'll see themes from other areas in what we discuss. All right, here we go. So like I said, at about 12:30, we'll turn to discussion of PFRH programs and the application process, answer all of your questions or as many as we can in the time that we have. But right now, I'd like to turn the discussion to our students and faculty. So I'm going to stop sharing my screen. And I'm delighted to first welcome Shelby Rolfe and Dr. Annie Smith. So we stop sharing my screen so we can all see each other better. Great. All right, and so to kick off our discussion, Dr. Smith and Shelby, could the two of you please introduce yourselves and share a bit about your public health interests and expertise?
Sure. Hi, everyone. It's so nice to be here with you. I'm Dr. Annie Smith. I use she, her pronouns. And my area of focus is, intersectional across our department's area of focus. So I focus on adolescent sexual and reproductive health. Earlier in my career, I did a lot of work around menstrual health in Kenya. And when I came to Hopkins as a master's student many years ago, I transitioned more so to domestic adolescent sexual and reproductive health. So I work with folks in Baltimore City and across Maryland to implement community-wide youth sexual health programs and to evaluate them. And I also do work on developing and evaluating interventions, including technology-based interventions to support male sexual and reproductive health and research translation, which we'll talk about. I'll hand it over to Shelby.
Hi, everyone. I'm Shelby. I'm a second-year MS-PH student in the Department of Population, Family, and Reproductive Health. Kind of as Sally mentioned and Annie had mentioned, there's a lot of kind of intersecting of interest here. So I'm interested in sexual and reproductive health, but also kind of adolescent health. So I work with Annie on a lot of adolescent sexual reproductive projects. I am a bit of a career switcher. I worked in corporate market research before this, so I love qualitative research. It's kind of my world I live in, and have been fortunate to be able to kind of use some of those skills while at Bloomberg.
Great, thank you so much. So could you tell us a little bit about one specific project that you work on together? Maybe tell us a little bit about the research question that you're trying to answer, as well as your specific roles on the project and how you work together.
Sure. So I have the pleasure of working with Shelby on a few projects, but something that we work a lot on together is called Thriveology. And Thriveology is a collaboration between the Center for Adolescent Health here in our department and an organization called Healthy Teen Network that is really a capacity building organization around youth sexual health that works nationally. And so Thriveology is really focused on identifying and translating trauma-informed and inclusive approaches in adolescent sexual and reproductive health. So at the center, we are the research partner on this project. So it's our job to really collate and synthesize the research on trauma-informed and inclusive practices, and then support Healthy Teen Network, who are, their expertise is in the area of practice, in translating that research into user-friendly, actionable resources that youth supporting professionals can use who are doing sexual and reproductive health programs and healthcare. And so I, on this project, am leading a systematic literature review to compile trauma-informed and inclusive approaches that support LGBTQ+ young people. And so Shelby and I have worked a lot on that, but there are lots of other projects to Thriveology that I think Shelby is better equipped to speak to. So I'll hand it over to her.
Thanks. So yeah, one of the cool things about working on Thriveology is there is a lot of different kind of needs and projects and things that we can work on. So like Annie said, we've been working on a literature review, which has been my first literature review that I've worked on. So has been very cool to kind of see all the steps in the process and be part of that, and, working on manuscript drafts. That has been really valuable. I've also been able to put some of my qualitative skills to use doing some kind of quality improvement work with Thriveology's youth leaders. So talking to them about, things they really liked about being youth leaders, room for improvement, and kind of, having those kind of focus group discussions, analyzing that, putting together a little report for Healthy Teen Network. And then Healthy Teen Network also has the occasional need for other resources. So we helped pull together some research on historical abuses of medical trust for LGBTQ people and BIPOC people. So it was just kind of another avenue of being able to kind of collect research, kind of build it out into a deliverable to share with the Healthy Teen Network team. And then just kind of above, all of the work is really the sense of collaboration as well, and being able to work not just with, Annie, or not just with people at Hopkins, but also other organizations, and see people doing jobs that are, jobs like something I might want to do after this. So that's been really great too.
Thanks. It's really exciting to hear about that partnership. I actually, back in the day, had an internship with Healthy Teen Network and really enjoyed it. But yeah, learning about how there are partnerships between Johns Hopkins and maybe more community-based organizations to really bridge that gap between research and practice. So would either of you like to share any other details about sort of the public health impact of the projects that you've described, or, that maybe actual or intended outcomes of all of your work?
Sure. I think ultimately the goal of Thriveology is to improve the quality of sexual health education and care by making it more trauma-informed and inclusive and affirming of diverse young people. And currently our focus is really on LGBTQ plus young people. And there have been exponential increases in legislation that's been introduced in the US to restrict the rights of young people who are LGBTQ plus when it comes to accessing information about themselves and their bodies and seeing their identities reflected in their educational spaces, and also with regards to their access to evidence-based best practice medical care. So we feel very much so that, and the evidence points towards a real need for support for people who work with young people, to have a greater understanding of approaches that are inclusive of LGBTQ plus youth in sexual and reproductive health. So we're really excited for our systematic literature review findings to be disseminated, because we really even focused on writing up the findings so that they're actionable. We have, basically made a list of practices that professionals can implement. And in doing that, we're also giving the Healthy Teen Network team a list of practices that they can make resources around. So yeah, I think that's something that we're really excited to be working towards on this project.
Thanks so much. So in the interest of time, I think I'm going to switch to our next student, but for all of our attendees, if you have any questions for Dr. Smith or Shelby, feel free to type them in the chat, and then we should also have a few minutes toward the end of our conversation. But yeah, for now, I'm very pleased to welcome Kayla Lynn. Kayla will speak specifically about her work with Dr. Erin Hager. Dr. Hager is an associate professor in the department. She was really excited to be here today, but is unable to attend because of family obligations. But we're super appreciative to Kayla for joining. So Kayla, do you want to introduce yourself?
Sure. Hi, everybody. I'm also a second-year MS-PH student in population, family, reproductive health. So I've been with our research group since August of 2024, so a little while now, which is very exciting. I love being able to work with Dr. Hager, so it is a little bit sad she's not able to be here, but you'll probably see her at some point.
Great, thanks. Do you want to tell us about a specific project that you work on with Dr. Hager?
So one specific project that we work on is the what's called the COVID family study. So we're in a different phase for this study. All of the data has been collected. They were able to build a really good rapport from families from other studies before the pandemic. And so the COVID family study really looks at longitudinally from a year before the pandemic, during, and then a year after. And ultimately, this study was they had a couple aims, and I'm reading it off of my paper on my iPad here, but they're looking to kind of evaluate the long-term impact of pandemic policies and disparities that are related to child wellness and health behaviors, specifically looking at underlying mechanisms linking the COVID-19 policies to child health, health things like obesity and excess weight gain, and ultimately kind of what those factors kind of impact onto later onto healthcare costs. And then so specifically what I'm doing with this study, since we have a lot of data that has been collected from these couple years, is that I'm doing a lot of the qualitative data analysis on the interviews that we have. And from there, I'm also working on a manuscript and kind of coming up with and looking into the relationship between mealtime routines and kind of the benefit, pros, cons, and the impact on kind of child health behaviors and things like that. So.
Thanks so much. Do you want to talk a little bit more about any other projects that you work on with Dr. Hager?
So we have a couple other projects going on right now, one being a FRAC project. So the main thing that we're doing with that project, it's actually in the very beginning stages. So we're just starting data collection. We have passed kind of our pilot testing, and ultimately we are doing is that we are working with middle schoolers and high schoolers, that kind of age range, and trying to develop a new measure so that we can kind of better understand what adolescents are really looking for like school meals and things like that. So given that there are a multitude of nutrition policies and requirements that are needed for school meals and certain nutrient levels, that's not the right word, but things like that, so that have to be included into school meals. And so really getting letting students kind of have a say in like what are they looking for in these school meals? Do they even eat school meals? Do they eat the school breakfast, the school lunch? And what kind of things do they want to see when they're eating it? Like, does it taste like it was made with love? Is it warm? What are the textures and things like that? And so kind of having being able to develop some measures for these things that it can better inform later on.
Thanks. Yeah, as a parent of two fairly picky eaters, I feel like my kids would love to provide some input for that study, but that's great. Do you want to, I think you've touched on it a bit about sort of the public health impact of all of this work, but do you want to just say a little bit more about that?
So the main thing that we're looking at is kind of the impact, long-term impact, right, of these specifically for the COVID-19 family study. They're specifically looking at kind of the long-term impact of like these certain major environmental changes. The pandemic is definitely kind of one of those very available data sets. It's very prominent, and obviously had a major impact on families and families' lives and children's lives as well. And so being able to kind of see how their lives were impacted, their health was impacted, it doesn't just affect the child, it affects the whole family and things like that. And so how other major environmental disruptions can occur throughout someone's lifetime, and how, will maintaining a family mealtime routine or a family routine, will maintaining this kind of really benefit the child long term for their, various health and wellness, or will also, immediately getting back into extracurricular activities, or what other protective factors are present to kind of help mitigate a lot of these impacts and these changes. And so that's definitely one of the public health things that we want to be getting into.
Thanks so much, Kayla. So again, we will have a few minutes for our audience to ask questions about these research projects if you're interested in learning more. But I would like to shift gears just a tiny bit with our panelists for a couple of minutes and ask for you to share maybe one thing that you really love about living in Baltimore, or maybe one thing that you love about the school or the department. Shelby, could I start with you?
Yeah, I can share something I love about living in Baltimore. I moved here from Chicago, which is also a very large and bustling city. But one thing that I love about Baltimore is there's so much good food here, and just like cute, charming little, corner restaurants and tons of coffee shops and bakeries. And there's just, you know, I feel like I'm running out of time to go to all of the places that are on my list. Yeah, Baltimore, definitely. If you're a foodie person, it is a good place for you.
Lunchtime, and that answer definitely made me hungry. Annie, could I turn over to you?
Sure. Yeah, Baltimore is the fourth city that I moved to as an adult. And I fell in love with it, and I've been here the longest that I've been anywhere else. Something I love personally is access to nature. There are parks all around the city, and they're pretty much accessible from any neighborhood. So I really love being able to be in a city, but also be walking along a river, within 10 minutes. And then on a professional level, there's just so much opportunity and so much interest in partnering for the purpose of public health and for young people's well-being in the city. The Baltimore Health Department is the oldest health department in the country. And, we partner with the health department here at Hopkins and at the center. And it's just a really great place to learn about all the possible different public health and education programs that could be and are being implemented for young people.
Thanks so much. Kayla, how about you?
Think definitely one of the really cool things about Baltimore. So I'm from California. So moving across the country was very, very big, very little bit nerve-wracking. And so one thing I really like about Baltimore is that like the really quick sense of community. Shelby and I are in the same cohort. So it's always, I don't know if she can also attest, but I can definitely attest that like our cohort is very, very tight knit. And so you instantly have that community with your fellow classmates. And then also like extracurricular activities, like talking with some of our other friends, everyone has, different hobbies, but very quickly you're able to find community within your hobbies, within your extracurriculars. And then two of like, if you're a foodie, I'm also a foodie like Shelby, being able to like go and do something food related, also like with your said community too. So I think it's just really, really awesome how Baltimore, you're able to just, there's something for everyone here. So it's really cool.
Thanks so much. So our panelists are able to stay for a couple of more minutes. Are there any questions from the audience about what you've heard today? Give it a couple more seconds. Last chance, any questions? Okay, well, if not, I would like to thank our panelists again for coming and sharing a bit about your work. Oh, maybe we do. Yes. Ogechi, sorry if I'm mispronouncing your name. Would you like to ask your question?
Hi, thank you so much for the opportunity. My question actually goes to the first speaker, Dr. Annie. I don't know if I pronounced the name very well. So my question is, she's working in LGBT, how they assess menstrual case, and I'm also doing a research in that, in the sense that I'm founder of Cecilia for Empowerment Foundation, a non-profit advocating for menstrual health, period poverty, sexual reproductive health rights of women in underrepresented community. So I want to know, like, if she's accepting students or if she's interested in collaborating with me. I base in Nigeria. So that's my question. If she's interested in collaborating with me or she's accepting students, so I can reach out to her and share my work with her, what I've done so far, what I want to do. Yeah.
Yeah, thank you so much for your question. I am still very much interested in menstrual health. It's not a central component of any of my projects, but right now, but the way I continue to do the work is with students actually. So Shelby and I are working together on a menstrual health project right now through a special studies. I also worked with a student last year. So yeah, I would be happy to collaborate with students who are interested in menstrual health or any of the other topics that we talked about.
Please, can I have your email so I can be able to email you?
Yeah, I'll put it in the
Thank
chat.
you. Okay, thank you so much.
And Amu, do you have a question? Sorry if I'm mispronouncing your name. Is it Abdulakim? Amu?
Yes. Top greetings of the day from here in Nigeria. My name is Abdulakim. Although I joined a bit late to this particular session, but I really want to appreciate you all for the wonderful session that you had with us. I just wanted to be sure if there are researchers here present that are interested in global health with respect to bio-risk management. For example, I think probably the reason why I got this particular link was because I intended to have an aspect of a PhD program in risk management or environmental health. That is area that have to read risk management, biological risk management, with respect to healthcare facilities and biosecurity level, high containment biosecurity.
I'm sorry, I would you mind typing your question in the chat? I've been getting little pieces of it, but it's a bit muffled and hard to hear. I'm not sure we'll be able to capture understanding your question correctly. Are you able to type in the chat?
I'll do that now.
I'm sorry.
I'll do that now.
Okay. Okay, thanks. How about Abdullah? Do you have a question?
Yeah, thank you. I actually want to know about the interview schedule that was luckily I get one from the PhD program, but I am a bit confused about its schedule. If you can give me some insight, because I have been scheduled multiple interview with PhD student and faculty
Yeah, so
member.
we will, because that is an individual question, we can work with Gilbert to make sure that you have the information you need. So maybe if you want to stick around toward the end of the session, we could talk with you one-on-one. Thanks.
Okay, thank you.
Yeah. Any other questions for our panelists before they go? I did see one question in the chat that Shelby answered about sort of working across departments and to work interdisciplinarily. And Shelby, I'm reading through your question, but I think that often we do have students and faculty in the department who work with other departments here in the school, but as Shelby is mentioning, also within other divisions at the school. So with the School of Medicine, Dr. Smith co-teaches a class with a doctor in the School of Medicine here in the department. So I do think that that is encouraged and there are a lot of opportunities there. So we are going to turn now to talking about our specific programs, application procedure questions, things like that. But again, want to thank our panelists so much for joining and giving our guests a sense of all of the really exciting work happening here. So thanks so much for joining. You're welcome to stay on and hear more, but I suspect you already know it all. So feel free to hop off, but thanks again. Eight. So I am going to, can you see my correct screen?
You need to make that's
Okay.
presenter mode.
Is that good?
Perfect.
Great, thanks. All right, so I will talk for a little bit about, like I said, about our programs and our the procedures to apply and things like that. Again, feel free to put your questions in the chat. I expect that we will have more questions than we can answer, but we'll try to get to as many as we can. So again, just as a reminder, I'm talking about programs today that are based in the Department of Population, Family, and Reproductive Health here at the school. So there are 9 other departments that have their own programs. We also have some school-wide programs like the MPH and the DRPH that are not presented here on this slide. Again, I'm just focusing on degree programs that are offered through the PFRH department. So we have 2 master's programs. One is an MSPH and one is an MHS. Our MSPH is an on-campus full-time program. So both Shelby and Kayla are MSPH students here in Baltimore completing this program. It takes 2 years to complete. The first year of the program is intensive coursework. Then those MSPH students do a field placement during the summer and fall of their second year, and then return to taking courses and completing a master's essay. We also have an MHS program that can be completed on campus full-time in 1 year, or students can complete it on an online part-time basis over between one to 3 years. So that does not have a field placement, but it is a lot of coursework and a master's essay. And then we have our PhD program, which is on campus full-time. So students do come here to Baltimore to complete the program. We provide 4 years of tuition funding. I mean, we can talk about the funding package if people have questions, but the PhD program is set up so it's about 1.5 years of intensive coursework, and then about 2.5 years of maybe still taking some courses, but mainly focusing on the proposal and dissertation work. Here are some of the components of the MSPH program again. So all of our MSPH students take biostatistics, epidemiology, and ethics. Students also complete coursework in one of those areas of interest that I mentioned earlier. Students complete some requirements related to the Council on Education and Public Health that any accredited school of public health here in the US has these same requirements. And then, like I said, our MSPH students do field placement and a master's essay toward the end of their program. The MHS has some similar coursework, but it is a little bit more focused on research methods competencies. And like I said, it is only 64 credits compared to 128 credits. So this program can be completed in 1 year if you do it on a full-time basis. I think I also mentioned that the MHS can be completed in person full-time or on a part-time basis online. So there's some flexibility with that program, but it does require applicants to have 2 years of full-time work experience in order to apply. I do want to briefly mention that in addition to all of those degree programs, we also have some we offer some certificates. We have some that I've listed here on this slide that are offered by our department, but there are just a ton of other certificates offered by other departments in the school. So I would encourage you to explore that. A lot of our degree seeking students will complete certificates while they are here, but students can also, who are not enrolled in a degree program, can complete our certificates as well. Our PhD program, our PhD application deadline has passed, so that for a fall 2025 start, the application was due December 1st. If you are interested in applying for a 2026 start, the application there again would be December 1st. But for this year, the application process is closed. However, the application for our master's programs is still open. We have a final deadline of June 1st for a fall start for these programs, but we really encourage everybody to apply as soon as they can, as early as they can. We do have some department scholarships for our MSPH students that are awarded as we identify qualified applicants. So you have a higher chance of being awarded a scholarship if you apply early. We also have a school-wide need-based scholarship for MSPH applicants, and you have to apply by February 15th, which is right around the corner, in order to receive priority consideration for that scholarship. If you are an international student, you should apply by May 1st in order to make sure that you have time, if you're admitted to the program, to do all of the visa processing. Really, the earlier the better. There as well, but May 1st, it gets difficult to get your visa if you apply later than that. Again, our application is open until June 1st, but apply earlier than that if you're able. And we'll turn to questions now, but I really want to encourage you all to stay connected. So we'll get a chance to talk with Kristen and Gilbert now. Kristen McCormick is our academic program manager who focuses on master's programs as well as certificates. And Gilbert Morgan is an academic program manager for our PhD program. We also have social media that you can follow to stay engaged that Mary Alice, who is our communications associate, runs. So please stay connected. So again, thank you for attending this session. I'll send out an email later today or tomorrow with the recording of the session. But for now, I'm going to stop sharing my screen, and for the next 20 minutes or so, we can just answer questions. Feel free to come off of mute or and ask or type into the chat. So Bonsu, I see that you have a question.
Yes, please. Please, I'm an admitted student to your master's program in population, that's MASH program. And then I want to find out. I applied for PhD and unfortunately I didn't get. And I had the admission last year, which is 2024. So I want to find out if I get this and then come and then finish this course, can I continue with the certificate after graduation for the PhD program in population health? I don't like that's what I want to know. Yes.
Thanks. So if I'm understanding your question correctly, are you asking if you come and do a master's program here with us, are you able to continue into the PhD program? Is that correct? I will explain briefly the sort of composition of our department. So for our current master's programs, we have about 30 students who come in a cohort. So Kayla and Shelby are one or two of about 30 students in their cohort for the MSPH program. And then for our PhD program, we admit about 4 students per year. The PhD program is incredibly competitive. We had about 200 applications this year for only 4 slots. And so you are, and we do have students complete our master's program and apply to our PhD program. Unfortunately, we can't admit everyone. There are so many qualified applicants who apply, and doing a master's program in our department does not guarantee that you would be admitted into the PhD program. So I hope that answers your question and gives you a little bit of a sense of just how competitive our PhD program is.
Hello, madam.
Yes.
Sorry. Due to my network, I had problems. So I was saying that last year I had admission to I applied for PhD in population health.
Yes, I think I got
Yes.
I got your question. I think you dropped off right when you finished your question. So were you asking if you've been admitted to the master's program? Congratulations.
Yes.
If you come and complete the master's program, can you continue on into the PhD program? Is that your question?
Yes. Yes, please.
Yeah, so and sorry, I answered this before and I think you dropped off. So congratulations again on admissions to the master's program. I was saying that in our department, we have about 30 master's students who come in every year, 30, 35. And then for our PhD program, we have 4 students who come in every year. This year, we had about 200 applicants to the PhD program for only 4 slots. So it is incredibly competitive. And we have our own master's students who apply to our PhD program, and they're just not guaranteed admission because it is so competitive. And so we would love to have you join our master's programs. I think it would strengthen your application to any PhD program, but does not guarantee admission. So I hope that gives you a little bit of a sense of the size of our programs and just how competitive the PhD program is.
Okay, thank you very much. Thank you.
Yeah. Abdullah Akeem, do you have another question? Or was your hand raised from before?
Okay, yes, yes, true.
No, I remember. Last time I would call on
I'm sorry, we can't hear you very well. Would it be possible to ask your question in the chat? I'm sorry, we're having trouble hearing you.
Can you hear me now?
Not well. It's very muffled. I'm sorry. I think it would work better if you typed into the chat.
Okay, I will tap.
Now we can hear you. Do you want to try one more time?
Is it better now?
Yes.
Okay, so I was just trying to ask. I saw you said that the deadline for application for PhD is May 1st for international students.
So that is the
For interna-
deadline for our master's programs. The deadline for
Okay,
the PhD program has passed. The application is closed for the PhD program.
okay. But for the masters,
Yes.
having a master's before in public health, does it give additional let's say additional kind of age when one is to be considered for admission?
If you have previous experience or a previous degree in public health.
Yes, previous degree in public health, but different projects and previous experience, would it give kind of age?
Yeah, so the way that we review applicants to our master's programs is we look at your academic history. So where you have gone to school, what degrees you've received, and how you did in those academic programs. So we're looking at your academic background. We're also looking at your professional experience. For master's students, for our MSPH program, we don't require that you have full-time experience. So we do admit some students who come directly from an undergraduate program. But what we are looking at professional experience, that could be part-time work experience, it could be volunteer experience, things like that. And if you have full-time work experience, we'll consider that. We also look at your personal statement, and we want to see, learn a little bit about your story, why you're interested in public health, why you're interested in PFRH specifically. Maybe you can tell us about classes you want to take, faculty you want to work with, and a bit about your career goals. And then we'll also consider references. So those ideally are from supervisors or professors who know you well and can speak about your ability to do well in an academic program. And so we look at all of those areas together. And certainly if you have coursework in public health, or if you have experience in public health, that will strengthen your application. Although, like I said, we don't, we want to look at your overall story and make sure that the program is a good fit for you and will help you in your career goals. And so that experience in public health certainly helps your application.
Yeah, thank you very much, Ma. I have one other question. Sorry, I hope I'm not too, that's not going to be too much. So second question is with respect to funding, are there funding available for master's MSPH, that is Master of Science in Public Health?
Yeah, thanks for that question. So for the Masters of Science in Public Health program, I would encourage you to look at our website to learn more about the different funding available. There are a few different mechanisms that we have for students. All MSPH students who are in good academic standing receive a master's tuition scholarship. And so in year 2 of the MSPH program, you can get like a 75% scholarship. Some students might split that a little bit differently, but essentially in year 2, you get a 75% tuition scholarship. We also have scholarships that are offered through the department, and we are looking for students, our best applicants who meet certain criteria, have interests that maybe are aligned with maternal and child health here in the US, or with global women's sexual and reproductive health. We have a few different scholarships, and we consider applicants for those scholarships as you apply. There's no separate application process for those PFRH scholarships, and just know that we're again looking for your story and your previous academic performance and experience and things like that in considering you for those scholarships. And then we also have a school-wide scholarship that is need-based, and so when you apply, you would send some information about your level of financial need, and we consider students for that scholarship. Like I said, to be considered for that scholarship, you really need to apply by February 15th. And so those are just some of the funding mechanisms available. The university or the school also has some more information for students generally about funding, and we can find the link to that and send out with the recording. So
Thank you very much.
Yeah, you're welcome. So now I'll turn to Yashish was.
Okay, excuse for my delays in meeting of the time. I have one question regarding with the opportunity of the scholarships. Let me say, express my background experience. I have more than 7 years professional and teaching experience in the health science colleges, and my background is my BSc degree is midwifery, and the second degree is Masters of Public Health in Reproductive and Child Health. My future interest is to study the PhD programs regarding with reproductive and maternal health related areas. If you have any opportunity or chance to accept me, I am highly interested. Thank you.
Thanks so much. Thanks for attending this session. Did you have any specific question that we can answer?
For the time being, I haven't any question. My question is only this.
I'm sorry, what is, I think I missed your question.
Yes.
What, do you have a specific question?
My question is, if you have any space or opportunity to join PhD programs in your university, that's my question.
Thanks. Yeah, so I can talk again about our PhD program. We admit about 4 students every year. The application deadline was December 1st. I'm not sure if you applied this cycle, but you're welcome to apply for the cycle next year. The application will be due December 1st again. Like I said, the PhD program is very competitive. We had about 200 applications this year for only 4 slots. So we have more qualified applicants than we can possibly take. All of our applicants are just incredibly talented. But there's an extensive review process and interview process for our PhD students. So I encourage you to apply. Well, let me pause and just see if Mary Alice, Gilbert, or Kristen, if there's anything in the chat that you think would be easier for me to answer.
Okay, I am already applying my necessary documents as September 1st. I don't know the ongoing process of that application process, but I have already applied at that time for September 1st in 2024.
Okay, thanks. I think I did see another question about the PhD application timeline. Gilbert, do you want to say anything about that?
Yeah, sure.
Okay.
Sorry,
Thank
I'm
you so
answering
much.
a lot of questions
Yeah,
in the chat. Yeah, so the timeline for you said for the interviews, right?
Or just if someone applied to the PhD program, yeah, timeline for hearing back about either getting an interview or yeah, a different decision.
Yeah. So so our interviews are held in generally towards the end of end of January, early February. So applicants should hear back about either interview invitations or decisions on their application around that time. And then if you make it to the interview stage, after interviews are conducted, you will know a decision roughly around 1 to 2 weeks. And because, there's a shorter turnaround after the interviews, only because of the April 15 deadline of letting us know if you plan on coming into the program.
Thanks. Great. How about Al-Razi? Dr. Al-Razi?
Thank you for the nice session. My question it is, I have a Bachelor of Pharmacy and Bachelor of Medicine and Surgery. At the same moment, I have a Master of Clinical Pharmacy. Now I'm acting as a consultant clinical pharmacist. So my question, I'm asking if I'm eligible to apply for direct for PhD, or I supposed to do the Master of Public Health first. Thank you.
Thanks. Yeah, so for the PhD program, we don't have any specific requirement about the degrees in terms of like master's degrees that people are required to have. We look at the application holistically, so very similar to our master's applications that I described the process, looking at academic background, academic performance, as well as work experience. For the PhD program, we really want to see demonstrated success in research specifically, so that while that's not required for our master's students, we do want to see that our applicants have engaged in research and sort of demonstrate a clear commitment to conducting research. And you could maybe have done that through full-time work or through research assistant positions as you've earned different degrees. So just a short answer to your question is we don't necessarily require like a master's of public health to apply to the PhD program. I think that generally does strengthen an application, but we are looking at applications holistically. If you do apply to the PhD program, you can always, we have a box that you can check to indicate that if you're not admitted to the PhD program, that you'd like to be considered for our master's program. So you don't necessarily have to apply to the program separately. And if you are rejected from the PhD program, we would look at your application and consider you for admissions to the master's program.
Thank you.
Yeah. How about Millicent?
Yeah, good evening.
Hello.
Yeah, I am Millicent from Ghana. Millicent Azori from Ghana. I'm a midwife by profession and interested in pursuing MPH, specializing in maternal and child health. I started a international verification with transcript evaluation, but I am not able to finish. And with the MPH, if you are going to apply, unless you do through the SOFAS application system. Now, I'm not done with the transcript evaluation. I don't know how the school can help me to be able to go through the application process.
So if I'm understanding correctly, you've applied to the MPH program and you have sent your transcripts to Wes for credentialing. Is that the stage at the process, at the application process that you're at?
Yes, the application process have not been gone through because of the West evaluation.
So we do,
which is not completed.
Mm-hmm.
So I need to complete the West evaluation before I'll be able to apply on the SOFAS platform, which I have not been able to complete the West application. So I don't know how the application will go through. So I wondered if the school could have a way of applying directly without passing through the SOFAS.
Thanks. So for any international applicant or any student who has completed a degree at a university that's not based in the US, we do require that the transcripts are evaluated by a certified credentialing agency. Wes is the preferred credentialing agency, and that is a requirement in order for your application to be considered. So I think if for some reason Wes is not working out, you could use a different credentialing agency. And there's more information for international applicants specifically that we can send when we send this recording. But international transcripts are required to be verified in order for us to consider your application. But I'll send the link for international applicants if you haven't seen that yet. Becky, would you like to ask your question?
Yes, thank you very much. Another question from me. So I wanted to ask about possibility for application fee waivers, and also that for the SOFAs, even one with West evaluated credential, do you need to send the official one or the unofficial copy from the West evaluated credential, after which when you get to the university, you can always, or when the admission is decided upon, you can always send the official one to the school? Is that possible? Two questions now: application fee waiver and possibility for the official West or the unofficial one. Thank you very much.
For the fee waiver, you can apply for a fee waiver directly through SOFAS. They do have some assistance with fees directly through SOFAS. The PFRH department, we don't provide any fee waivers. And then for your question about credentialing, Kristen or Gilbert, feel free to correct me if I'm wrong, but we do need the official credentialing documents in order to make an offer of admissions to a student. So we do need that official documentation.
Yes, and let me just add on to that. It's really important that you start the transcript evaluation process early, right? So if you know that you're going to apply for, I mean, that's for both programs. If you know you're going to apply for the PhD program, you should probably start the transcript evaluation process at least 5 to 6 months in advance to the December 1st deadline. And that's the same for the master's program. Especially for Wes, there's a backlog as far as reviewing transcripts. So it's important to get the process done early. Now, there are other evaluation or credentialing agencies, and I think Sally had alluded to this. You're probably better off maybe going to someone else besides Wes if you are outside of that 5 to 6 month window, just because their timelines are a little bit shorter. And the list is available on the admissions website for proof credentialing services. And I believe Sally also mentioned that she may send it out after this discussion. So yes, that is, yeah. So yeah, we cannot admit you without actual credentials. Now, are there circumstances where, let's say you have your master's degree, your bachelor's degree credentialed, but your master's degree is still in progress? There are special circumstances where we can review your application. However, we cannot submit any decision until everything is completed. Okay.
And Becky, I think I saw your hand raised. Did you still want to ask a question?
Yes, please. I just checked it. It's like remaining just 1 minute. Thank you so much. It's been a wonderful presentation and I'm happy to really join. My question is, does the school have like non-governmental agencies, organizations that deal on maternal and child health that you can like collaborate with and work with as a student, like field practice, internship, stuff like that? Thank you.
Yeah, thanks. So are you interested in the master's program, like the MSPH program?
Yes, I actually applied already for the MSPH program, but I'm interested in maternal and child health. So I just want to know if there's something about the field placement and
Yeah, thanks. So for the field placement for it, that is a required component of the MSPH program. So again, all of our MSPH programs spend 4 to 6 months doing 1 or 2 field placements. Sometimes that field placement is with faculty here at Hopkins conducting research. And so for Shelby and Kayla, who we heard from, I think a lot of the work that they were discussing today was actually part of their field placement. But other students decide to go outside of Hopkins. Sometimes that is with a like a Hopkins partner or a partner of faculty members here. But we do, for the field placement, it is the student's responsibility to, make priorities about what's important for them for the field placement and do the search themselves and acquire the field placement. But an important part of that search that we support you with is talking with faculty here, talking with the department, talking with other students who are in the cohort above who have secured very exciting field placements, and utilizing the networks that are established here. And there are certainly a ton of faculty in the department who work on maternal and child health who have connections at various outside organizations, and in certain cases can support students to try to identify internships and other opportunities at those organizations. Yeah, I hope that helps.
Great, thank you so much.
Yeah, you're welcome. All right, so it is 1 o'clock. I want to be respectful of everybody's time. I realize that we may not have gotten to all of your questions. I can stay on a couple more minutes to answer questions, but maybe it makes sense to stop the recording now, and people are welcome to leave. But want to thank everybody again for attending today's session. We hope that you apply. We hope that you come, and hope that you enjoyed learning today about the exciting work that is taking place here in PFRH. So thanks, everyone.